This webinar is part of the Managed Care Readiness Training Series geared towards home and community-based service providers. My name is Meg Beyer. I'm one of the project managers and coordinators for MCTAC, and I'm very excited to be introducing this webinar this morning. The experts at Health Management Associates will be walking us through the overview of the upcoming in-person training on HCBS Medicaid Managed Care infrastructure development, as well as the functional assessment tool. The Health Management Associates team will be facilitating the in-person training that today's webinar outlines. That in-person training is going to be on Monday, May 11th from 9 to 4 p.m. at the Kimmel Center in New York City. Please go to mctac.org to register for the event. Not only does mctac.org contain all of the information and registration links for upcoming trainings and events that we are hosting, but it also contains many managed care readiness resources that MCTAC has compiled, including a glossary of terms and frequently asked questions. If you have any questions at all during the webinar today, you can always use the chat box to submit them, and we'll do our best to get them answered. For any other questions that you might have related to managed care readiness, unrelated to the webinar today, please feel free to email us at mctac.info@nyu.edu. And then with no further ado, I want to thank Megan Schilke, Josh Rubin, and Melissa Corrado with Health Management Associates for providing this training and walking us through the webinar today. With that, I'm going to pass over the presenter baton to Megan, Josh, and Melissa, and thank you all for joining us this morning.
Thank you, Meg, and good morning, everyone. We're thrilled to be here. I'm Megan Schilke, and we're excited to work with MCTAC to provide this sneak preview for the upcoming in-person training on May 11th at NYU's Kimmel Center, and to talk through the functional assessment that you've all been extended so that you can complete that in preparation for the upcoming training. I'm joined by two of my colleagues from Health Management Associates who will introduce themselves in just a minute. I'm going to take a moment and tell you about HMA for those of you who may not have heard of us. HMA is a consulting firm specializing in health and behavioral health system restructuring. We have a particular focus on the publicly funded health systems, and our work across our 17 offices around the country includes strategic planning for providers ranging from small community-based organizations to large multi-service providers and hospital systems. We do delivery system reform planning and implementation for local, state, and federal government, and procurement and operational support for many managed care companies. HMA brings a strong interdisciplinary expertise with staff backgrounds that include health economics, public health policy and administration, healthcare finance and reimbursement, clinical services, program development and evaluation, and information systems. So we've been actively involved in delivery system reform and health home implementation, as well as the carve-in of behavioral health services throughout the country in many, many states. Many states who have gone through or are going through very similar things to what New York State is going through, or some version of it. And we're happy to bring some of that experience to bear for the New York State behavioral health community, which is where several of our team members, including myself, come from. HMA brings a deep and expanding commitment to behavioral health, and we're all personally committed to and invested in the success and expansion of recovery-oriented rehabilitative services for people with mental health and substance use needs. So with that, I'm going to just say a word personally about where I came from before HMA. Some of you may have known me in my role as Chief Program Officer for Mental Health at the New York City Department of Health and Mental Hygiene, where I had the privilege of overseeing the city's portfolio of services that are the corollary to these home and community-based services that we'll be talking about today and on the 11th. This includes the range of employment, clubhouses, supportive housing, peer support and advocacy, mobile crisis respite care coordination, et cetera. And I also worked with the Coalition of Behavioral Health Agencies prior to that. So for those of you I haven't met, I look forward to meeting you in person on the 11th. I've had the privilege of visiting and observing many of your programs up close and personally, and I'm excited to be able to help with the transition into managed care and the implementation of home and community-based services. So I'm going to turn it over to Josh Rubin to introduce himself.
Good morning, everybody. Like Meg, for those of you who don't know me, I also grew up in New York City's behavioral healthcare system. I was at the Department of Health and Mental Hygiene, where I was an assistant commissioner for mental hygiene policy and for alcoholism and drug abuse services. Also spent some time with the Coalition of Behavioral Health Agencies, where I cut my teeth in the field, and then was with both YAI and the Mental Health Association of New York City in operational roles. So I am both very much aware of the critical importance of the psychiatric rehabilitation services that you all provide, and also of the operational challenges with which you are confronted. So I am looking forward to this work and looking forward to seeing you all on the 11th, and then I will turn it over to Melissa so she can introduce herself.
Great, thanks Josh and Megan. I'm Melissa Corrado. I'm glad to be here. I've been working in healthcare in New York City and across New York State for almost 20 years, so for my entire career. In the past 2 years, I've been really working with providers on adapting to changes that have been brought about by healthcare reform, and some of these providers include behavioral health and health home care coordination agencies. My particular areas of expertise are in quality improvement and change management, including training and facilitation. And I'm really looking forward to working with you all and meeting you in person at the full-day session.
Thank you, Melissa. So what we're going to do is we are going to look briefly at the agenda for the upcoming training, the context and goals of the training on the 11th. And we're going to review the training curriculum so you have a sense of what will be included over the course of that day. And then we're going to walk through quickly the pre-training functional assessment tool that hopefully you've all received and opened and reviewed, but if not, you'll get an overview of the questions that are included. It's a brief, very concrete, focused 14-question assessment that's critical to be completed in advance of the in-person training. It will really help you be better prepared and to make that training more meaningful. It will also help us because there's no way to perfectly pitch the training to all different levels of understanding across the board. We know some of you have been very much steeped in this for a long time. Others may be very new to the ideas and the concepts of managed care, billing and infrastructure needed to bill managed care, the home and community-based services, and the surrounding reform efforts that sort of contextualize these changes to the behavioral health system. So we are going to use the functional assessments that you'll complete in advance in order to help us really target the content, the depth, the breadth, and the specificity to your individual needs through the course of that training day. So that's critical for us to do so. It's also a way for you to begin the conversations internally within your organizations. If you haven't already, I know many, many of you have, and many of you have been having these conversations for some time. But if there are elements in the functional assessment that sort of correlate to the domains of preparedness for this transition, we would encourage you to use these questions and your attempt to answer them as an organization as a way to initiate some of those conversations. So knowing where you will be and knowing that there's much to cover, it's important that we make the most of our time, and we want each of the segments of the trainings to be as meaningful as possible. It's intended to be a very practical training where you'll walk away with tools, worksheets, and information in your hand, in addition to what we hope is an increased understanding of the foundational elements of managed care, so that you're armed to move quickly into the necessary planning work within your agency that will be necessary for you to move successfully into the new managed care environment. And most importantly, to continue to provide the quality services that you're providing to the people that you serve. So I am going to mention briefly the context and the goals of the training. So I think many of you know that MCTAC has been providing a series of trainings. They range in breadth and topic area from the very specific concrete things that you need to do to become a managed care ready provider, including such things as applying for your MPI, such things as the revenue cycle management process. There's a range of very specific things that they're offering, and they're targeted to providers at different levels in their preparedness. This training specifically is targeted towards those organizations who either have never billed or have done very little billing of Medicaid or Medicaid managed care previously. to a lot of the providers who currently deliver what we consider our rehabilitative continuum of services, that have previously been funded largely out of your net deficit state aid contracts, through contracts with the city, grant-funded programs, those that have never previously been billed through the fee-for-service Medicaid program or through managed care. And so we are expecting and hoping that you'll be able to attend the training at a level where the leadership of your organization is truly represented, including CEOs, CFOs, COOs, the equivalent of your chief program officer or vice president for program services. Those individuals, and you are encouraged to bring a few individuals per organization to attend the full in-day training, such that you're leaving with a real team understanding of what this change will be. So that's the first set of goals. And the second set is really to arm you, as I said, such that you are walking out the door and enabling you to start your planning process for what you will need to do over the next 30 days, 60 days, 90 days, 6 months, 12 months, et cetera. So we are excited to be able to help you navigate that. The behavioral health carbon of the HCBS services is the focus of this particular training. There are a lot of other things going on, I know. There are lots and lots of things happening, a virtual alphabet soup of transformation. We have SIMs, FIDAs, DISCOs, DSRIPs, all sorts of things that we could talk about, but today and the 11th are specifically focused on the HARPs and the HCBS services that the state is implementing and that will be paid, fully reimbursable for New York City starting this summer, and then subsequently in 2016 for the rest of New York State. And while we'll mention briefly the larger landscape and the context in which all of this is occurring, what we will be focusing on, again, is the home and community-based service implementation, learning to work with and bill Medicaid managed care plans for these services, and positioning your organization to be successful in this environment. The full day in-person training will be held Monday, May 11th, as Meg from MCTAC noted, from 9 a.m. to 4 p.m. at the Kimmel Center. And what we've done is develop a curriculum in partnership with many New York State agencies, advocacy groups, the Managed Care Technical Assistance Center out of NYU, and our state partners from OMH, OASIS. And we are also open and welcome, of course, to any questions, suggestions, or feedback from any of you on the call today of things you feel are particularly important that we need to be covering. So the first part of the full-day training curriculum will be based on foundations and essential business and operations practices. We're going to cover the following essential concepts and infrastructure needs, including the big picture and the timeline and requirements for the implementation that's occurring right now. Also the foundational elements for working in a managed care environment, which include understanding the managed care organization's priorities. They are operating within their own set of expectations, regulations, and requirements that are established for them by the state and the federal government, by CMS and by SDOH. And others, so understanding the context in which they are operating, the requirements and the demands that they have to be responsive to can be helpful as you begin to communicate, negotiate, work with, and partner with them to deliver these services. We're going to share the basic managed care terminology so that you can navigate these questions, implementations, conversations with ease, so you're familiar with the vocabulary. We're going to talk about the process of contracting and the criteria for determining the appropriate level of care that will be required under managed care. We're going to talk about the famous utilization management and review practices, the differences between those two things. And we're going to share with you some examples of how those have been implemented in other places. We're going to talk about communication and reporting with your payers, the finance and billing structures that are necessary for you to successfully be reimbursed for these services. We're going to talk about member services and grievance procedures, requirements for access that you will need to be responsive to, meaning the amount of time with which you have to provide access to a referred individual, and the interface with physical health, social support, and health homes. As we move more and more to an integrated system, you will find yourselves with facing the requirement and the sort of industry standards that behavioral health and physical health are more and more integrated and provided in co-located and coordinated ways. Quality management, quality studies, and incentive opportunities. We'll talk a little bit about the various QI, QA functions, quality improvement and quality assurance, what the role of each of those is within an organization, how managed care thinks of each of those. We'll talk about how you demonstrate impact and value. And I want to pause for a moment here because this one is absolutely critical. It's important as you begin to navigate this world that it is a market-driven system that we are moving into, and that your ability to demonstrate the value that you provide to managed care, to payers, is absolutely critical to your success in the future and the sustainability of your services in the long term. So understanding, knowing who you're serving, what the impact you're having on their recovery in multiple dimensions, including the cost of their care, their utilization, and their health outcomes. All of those dimensions will be critically important to you to be able to say to a managed care company, here's what I'm doing, here's how it's helping, here's the value added that I'm bringing, because they have very explicit targets that they must reach of improved health outcomes for the individuals that they are responsible for, that are members of their individual plan, and they must do so within a capped rate funding. So your ability to help them meet those demands will be critical in your partnership with them. That requires data management and evaluation, your ability to analyze the outcomes and the effects of your own services and to really understand what's working and what isn't, and to be doing those constant activities of quality improvement. And then finally, IT system requirements. I know this is intimidating to many smaller organizations because it can seem like a huge cost investment, and we're going to talk about some of the different ways that you can achieve options for achieving those needs, but absolutely critical. The future, it will not be possible in the future to deliver a purely paper-based service for much longer. I'm going to pause there and see if there are any questions about those elements, and we're going to also then move on and talk about the second half of the day, which, I'm including in the first half of the day, operating in a managed care environment, which are the agency essentials and the options for you to develop the infrastructure that I mentioned above.
So if folks have questions, you can type them into the chat function in the WebEx. We do have a question about whether this is this training would be appropriate for current small organizations who may be considering forming partnering with a larger agency or figuring out some way to directly bill the Medicaid without partnering with some larger agency. And the answer to that is that that's exactly who this training is for. It's really built to help smaller organizations that may or may not have a history of billing Medicaid or Medicaid Managed Care figure out what needs to be done, and then figure out what are the strategic options and what are the strategic considerations that need to go into weighing those options. So if you have other questions, just type them into the chat function, and we'll try to take them as they come.
Okay, we're going to also mention that on the second half of the training day, we'll be exploring options for deploying essential practices. So what this means, and this speaks a little bit to the question I asked previously, is there are many options for how you can achieve what seem like quite a large list of functions that you may previously not have been performing that you will be required to perform in this environment if, in fact, you're billing managed care. And if you're still making decisions about that for your organization, this is absolutely an appropriate training for you to attend. What this will do is present a menu of options to you for how you might achieve this infrastructure that is needed. There are many options, and we'll go through with you the basic pros and cons, the benefits of each, and help you begin to navigate the decision-making process for your organization. So this is about developing a strategy and a business plan. It's about thinking about your organization in the context of managing change and sustaining gains. Small group exercise that we'll perform will help you begin to formulate your 6-month action plans for your organization and that we hope you'll come away with options to address these infrastructure needs, not necessarily with the decision made when you leave the room, although if you have an epiphany in that moment, that would be perfectly acceptable, but really to take back within your organization and to inform a larger planning discussion and begin to make those decisions with your organization. And then what immediate next steps you can take to refine your decision-making process. What you need to be doing right away, you know, starting the next day, and then the decisions that you have more time. The good news is that this is a process. There is a phase-in. This is not to be thought of as the switch flipping on day one of implementation. So, you know, while there's some sense of urgency because this is real and it's happening, and it's happening now, in particular in New York City, but also on the horizon for the rest of the state. And so it must be attended to, and it's important to know that this process needs to be underway for you. But at the same time, there's time for some of these decisions to be made. It will take time for all of these things, the various chips to fall into place. There are still a lot of decisions to be made, we recognize, by our colleagues in state government. And so we know that all of those things are happening in parallel, and that will be an ongoing process. So while there's a little bit of a sense of, let's get started, and there's some urgency to let's get started, not every question needs to be answered today or on May 11th or on July 1st at this point.
Just to interject with a couple of questions that have come in. There's one question as to whether or not this training is only for New York City organizations who have already been designated, okay, or whether organizations in the rest of the state should be attending as well. The training on May 11th is a New York City specific training, but we will be doing other trainings afterwards for folks in the rest of the state. Yes, and if you're in the surrounding areas around New York City, you're certainly welcome to attend the New York City training on the 11th. You know, for those in Westchester, Long Island, or the sort of near environment to New York City, it would be fine to attend these. It may be just as easy for you to attend one of the upstate trainings, which we anticipate there'll be at least one in Albany, at least one in the upstate region further north, and then at least likely to be one in the Long Island region down the road, but those have not yet been scheduled. We're looking at into probably towards the end of June or July for those dates. Where would I find a list of approved managed care companies in NASA or Suffolk? Okay, so there are designated plans who have been approved to do the HARPs and to be qualified health plans to deliver behavioral health in New York City. The designations have not yet been finalized for the upstate regions. There is a list online of those plans who have submitted letters of intent, so we can get you a link so you can see who those are, but the final designations by the state have not yet been made for the full state. And I think that's it for our current questions. But keep them coming.
Yes, thank you. These are great questions.
So I just wanted to spend a little bit of time talking about the very brief assessment that we sent out. And let me preface this by saying that we understand that there may be a little bit of assessment fatigue, and that some of you have been doing very detailed, very rigorous assessments, and certainly the lengthy assessment on the MCTAC website is very detailed and is really extremely valuable. And if anybody hasn't done that assessment, I would just urge you to do so. It will really help you to understand where you are with respect to where you are going to need to be eventually. This assessment had essentially two purposes. The first was to help us make sure that this training hits the mark. We recognize that we are asking for high-level folks from organizations to come and spend a full day with us, and that's not a small investment. And so we want to make sure that that investment pays off for you all as well as possible. And the best way for us to do that is to get a very clear sense of where you are and what it is that we can share with you that will be the most useful for you. The other goal here was to conversation amongst yourselves and your senior teams. The questions are high level of necessity because we really did want to keep it very brief. And our goal here was that you should be able to sit down at your computer and, just answer the questions. We don't want you running all over your agency, tracking down information and digging through files. The goal here was for you to sit down and in just a couple of minutes be able to rapidly let us know where you are and also, sort of check in on yourself. That being said, if you sit down and you'll find that the questions all have essentially five options, I should say, Likert scale options: strongly agree, agree, disagree, strongly disagree, or don't know. If you find yourself saying don't know to a lot of the questions, it's an opportunity for you to identify that there is a chance for you to begin to get the ball rolling and to begin to overcome the coefficient of starting friction, which is always the hardest, and to begin to have those conversations with your senior team, with your board of directors, and to really begin to assess yourself and to open that dialogue. Just to be clear, this is not about right or wrong answers. There's no game of gotcha here. Nobody is trying to point out to you how negligent you've been. We know that a lot of you have been working very hard on this for a very long time. The real goal here is to help us see where are the biggest gaps so that we can really spend more energy, more attention on those places where it looks like there is the biggest need.
I would also just add or interject that the answers will not be shared with government and funders on an agency-by-agency basis. You can consider your answers confidential, and that we will be using them in the aggregate to inform the training, but not targeting or sharing or reviewing agency by agency.
The goal is also that in the afternoon, as Megan said, we're going to be our goal is for the afternoon to be more interactive and more of a workshop where you really begin to figure out what are the options that it makes sense for your organization to consider in terms of how to address all of these infrastructure needs. So the extent to which you have done a little bit of this work in advance, we think that you'll be better positioned to make better use of that afternoon time, which is really our goal, and which is why we're hoping that in addition to filling in the form online, you'll also print out a copy and bring it with you and use that as an opportunity to really see where you are and to open those conversations with your team. So just quickly to walk you through the 14 questions so that you see what they are, have an opportunity. If you have any questions about any of these, please, this is our goal here is that you understand exactly what these questions are so that when you sit down to answer them, you have some context. So the first question is about the extent to which you have contracts in place with the managed care organizations that will cover consumers for home and community-based services, and the question about where to get that list in Nassau, Suffolk is spot on. That's exactly the question. Who are the potential managed care companies, and what is the extent to which you have already begun to build a relationship with them? The second question is really just about the basic, conceptual underpinnings of managed care, and do you understand the nature of the paradigm shift that is underway with respect to the portfolio of services that you currently provide? The next question is about revenue cycle management, and we know that revenue cycle management is a phrase that either keeps people awake at night or puts them to sleep, depending on your personality type. We're going to do the best we can to make it as both straightforward and engaging as possible to talk about revenue cycle management, but some clear sense of the extent to which you already feel comfortable managing a Medicaid managed care revenue cycle will be really valuable for us in making sure that training is aimed at the right level. The next is about programmatic and technological systems and the extent to which you have both the technology and the workflows necessary to capture the kind of data that Meg was talking about that you're going to need in order to make the case to managed care companies and to demonstrate the value of the services that you provide. And I would say not just to managed care companies, but also to consumers. Level of care and utilization management requirements and the extent to which you're going to be able to, you feel like you are going to be able to or are preparing to meet those requirements. and the quality assurance systems as well. You know, one of the things that I think is a theme here that you'll see is that managed care organizations are going to have a different expectation than your government funding partners. It's not about better or worse, it's just about different. And so you're going to need to be able to answer a different set of questions than you have traditionally been asked. And so this is really just us trying to get a sense of the extent to which you're already able to answer those questions or need help figuring out how to do so. Again, compliance with the requirements of managed care contracts and understanding how to construct your organization's value proposition, two things that are going to be absolutely essential, and we just are looking for some insight and also, you know, for you guys to begin to think about what is our organizational value proposition. You know, how do we construct that? How do we demonstrate the value of the services that we provide? This is the extent to which you can disentangle the alphabet soup. There are so many different initiatives underway, and it's clear that you're going to need to respond to the different stimuli in different ways, but that you're going to need to figure out how to create a coherent answer to a whole bunch of them that all, at least in theory, are operating hand in glove, and that, you know, all of the different initiatives that the state has undertaken, there is a method to it. And so we just wanted to spend some time to get a sense from you all as to, you know, how much value you would find in us, you know, sort of walking through some of these and explaining some of them. The next question is really about knowing your population, knowing who it is that you're already serving, and understanding what it means to be HARP eligible and the extent to which you have a way of figuring out who it is that's in your program already is HARP eligible and who's not, because you're going to need to be able to continue, you want to be able to continue to serve both of those groups of people, and there are going to be different structures necessary to do that. And so identifying for yourselves the extent to which your population is eligible. Financial modeling. You know, the financial modeling requirements in a Medicaid managed care environment are much more complicated than the old sit down and make your budget, and, you know, it was all pretty straightforward. You know, what's it going to cost me to provide a program, and then how much, you know, is my contract from the state going to be? As we move from a program paradigm to an individual service paradigm, those processes of calculating get much more complicated, and we suspect that that's a place that we are going to want to focus some attention, but are hoping that you can help make sure that that we're right about that, or if we're not right about that, that we don't waste a whole lot of time on something that you all don't need. The next question, the last three questions are really about your strategic planning process and the extent to which your organization has really begun to grapple with these questions, the extent to which you have begun to grapple with these questions, and the extent to which you have engaged your board in those conversations, and the extent to which you're thinking about different options for addressing the infrastructure needs, and thinking about what are the things that you're going to want to prioritize, and what are the things that you're not willing to compromise on, and how you're going to come up with a strategic plan that enables you to meet these needs without compromising on the things that you don't want to compromise on. And so that is really a key component of this training, is to begin to help you think through what are some of those options, what are the costs and benefits of those options, what are the processes that you might undertake in order to implement those options if you choose them. And so the extent to which you have begun to think through these things and are walking into the room with a sense of having considered some of those options, if you have already done so, that will be great. That will really help make especially the afternoon even more valuable, even more productive. That is the end of the set of questions. There's a link to where you can enter your responses online, and then where you can download the PDF so that you have a paper copy to bring with you and maybe share with other folks in your organization.
Yeah, and I want to, somebody on our chat had asked about access to these slides. I want to, my colleagues at MCTAC just confirm that these will be available both on the website and also if they'll be able to be either just sent out by email to participants or exactly how they'll be able to be accessed. You can see here, this is the link for the actual survey. So if you want the survey questions, you can do that right now. And there also should have been, if you got the invitation to today's webinar and to the upcoming training, there was a link in that email as well to access the survey specifically. So for those questions, you can get them that way. Meg, are you able to answer if we can, how the PowerPoint presentation will be available to folks after this?
Hi, this is Morgan. Meg actually had to run into a meeting, but the PowerPoint will actually, the PowerPoint and the slides, the PowerPoint and the video recording will be sent out to everyone who attended, and I think they're going to be made available on the website as well, so everyone will have access to the materials.
Great, thanks. We also have a question in the chat about an organization who's providing services to other organizations rather than directly to the client. And so talking about billing opportunities and assessing benefits if you're not the direct provider. That's a great question. There are many organizations that provide services to other providers. Those are the kinds of things where you should be starting those conversations very early. Some of these questions will still be applicable to you, thinking about your value proposition, understanding the total cost of providing your services, being able to break it down in different ways and to package it and to think about what the future contract might look with between you and the purchaser of your services, whether it's a managed care company or another provider. It's all going to have to reflect the sort of current demand around providing communicating the value and the outcomes of those services that you're delivering, demonstrating the impact on the consumers that you're serving, that ultimately the service is reaching, helping to construct for those people who will need to purchase your services out of potentially a pot of money that's ultimately coming through managed care. If it's a subcontract of sorts, you're still going to have to meet many of these requirements and understand many of these factors and have some of this infrastructure in order to continue to deliver the care. Because in turn, those provider organizations who are your current customers will have to then integrate that into their larger thinking and planning around their financial constructs for delivering services to the individual. So that's a great question. Not every single piece of this will be applicable to you if your clients are other providers, but much of it will. And I think it's very important, and this can still be very useful for you. Other questions? Just a reminder about, of course, visiting the MCTAC website. I get their announcements and updates all the time. They're incredibly useful. Many of you, if you were able, I hope were able to go to the kickoff forums. If you weren't, there are the slide decks and previous training materials are available through MCTAC. They're wonderful. There's a whole range of things that you can access there. I highly encourage you to spend some time reviewing those. And of course, there are a number of questions that we continue to gather. When we get questions we don't know the answer to, we tend to share them through our colleagues at MCTAC up with the state and sometimes when possible with managed care organizations, which is just as a parenthetical, we are sharing aspects of this training and presentation with managed care organizations such that we're getting their input. It can make sure that we're reflecting their priorities accurately to you, and that while we continuously at HMA work with many managed care organizations, we want to make sure that everything we're presenting to you is consistent with where they are today in their thinking and planning around this implementation, because they're navigating many of these challenges as you are. And then, of course, the registration for the in-person training is, again, here, the link. Any other questions?
So here is a question. If a small service agency provides services to waiver agencies that bill Medicaid, can they continue to operate that way, or must they become their own agency? In other words, can they still operate as a subcontractor? So this is related to the last question that Megan just answered. There is still an opportunity for folks to serve as subcontractors, but that doesn't mean that they don't need to change anything about the way they're doing business. And that, you know, I think we would advise an organization in that position to think carefully about who are your potential customers here, and what is it that they are going to need if they're going to purchase services from you. And so this training will, like Meg said, will not be totally, not every element of this training will be totally germane to your organization's operations, but I think it will help you begin to ask some of the key questions that as a part of your organizational strategic planning process you need to be asking. So the short answer is yes, you can still operate as a subcontractor, but the long answer is you can still operate as a subcontractor, but it's going to be a very different environment to operate in, and you would be advised to be aware of those changes and to plan accordingly. If there are other questions, these questions are spot on and really helpful and already in terms of helping us think through some of what we need to talk about in the training. But if there are others, please.
I think that there's a question about accessing the link for the survey and such. I think we'll just try to get them emailed out as quickly as possible after we're finished here so that you have them. So if you're not able to access them directly right now from your screen, which I don't believe the hyperlinks will work from the WebEx option, but if you're not able to do so, they are going to be distributed very shortly thereafter.
And they're all in the invitation that you received for today's webinar?
Yeah. So we have another question about whether or not subcontractor work for a coordinating agency or the service agency. I think it's going to be, I'm not sure this can be answered universally if I understand the question. I think it's really going to vary organization by organization. You may have a specific question that you're looking to answer, and if that's true, you can certainly contact us directly and we can see if we can't help you if there's a specific situation that you're in, that your organization is maybe unique to your organization, that we could see if there's a way to address. Without a little more detail, it would be difficult to answer that today. If you're looking to contact HMA, the best way right now is you can email either myself or Josh, and we will make sure in the follow-up email that comes out that our email addresses and contact information are included. You should feel free to reach out to us if you have both additional questions, feedback about what is important in this particular training, or any other issue that we can help you address. And not seeing any other questions at this point, I'm going to turn it back to my colleagues at MCTAC to wrap it up. I want to thank everyone very, very much for taking the time this morning. We know how busy you all are, and we're really pleased to meet with you in person on the 11th and to work through these issues. And just a reminder to please complete the assessment and print it out, bring it with you in hand. That will really help us make the training all the more meaningful on the 11th and make the best use of your very valuable time. So thank you, everyone. We hope you have a wonderful weekend. And MCTAC, you want any closeout information you need to share?
Thank you so much, Megan, Josh, and Melissa. That was wonderful, and we're all looking forward to the May 11th in-person training. And remember to enter your survey responses into the links shown above, and we will send you the recording and the slides very shortly. Thank you so much for coming today. Bye.